So it being 5:30, we'll call the meeting to order of the Board of Health for March 14th. And if someone would read the COVID requirement.
I can do that.
Okay,
Trish, we usually make Trish do it, so.
You make me.
Due
Go
to
ahead.
the ongoing COVID-19 pandemic, in accordance with Chapter 20 of the Acts of 2021, suspending certain provisions of the open meeting law, public bodies otherwise governed by the open meeting law are temporarily relieved from the requirement that meetings be held in public places, open and physically accessible to the public, so long as measures are taken to ensure public access to the body's deliberation through adequate alternative means. This meeting is live on Zoom. The public may participate remotely by joining Zoom meeting ID number 880-9915-1478 or by calling 301-715-8592. For additional information about remote participation, please contact Heather Hampson, Administrative Coordinator at hampson@ayer.ma.us or 978-772-8220 extension 145 prior to the meeting.
Thank you very much. So the meeting is called to order. We are in open session. And the first item on the agenda is an executive session pursuant to Mass General Law, Chapter 30A, Section 21A, exemption number 3. And do you want to read the rest of that, Trish, or?
I don't.
Oh, I have it. I can do it.
Okay,
So I just have to pick up where you left off, right?
yeah.
Yep.
Okay, to discuss litigation strategy with respect to the case of Mimi's Place LLC versus Board of Health of the Town of Ayer et al., Middlesex Superior Court, CA 2181 CV 4967. If discussing the matter in open session will have a detrimental effect on the town's litigating position and the chair so declares.
The chair declares, and is there a motion to go into executive session?
I'll make a
Yes.
motion that we go into executive session.
Thank
Okay,
you.
I'll second.
Peter's motion's made, motion seconded. Hearing no discussion, all those in favor, Ms. Papineau,
Aye.
Ms. Peters,
Aye.
Mr. Slarski, aye. So the board will now be in executive session. We'll adjourn executive session just to go back into open session. Yeah, the Board of Health will be back in open session. The first item on the agenda is public input.
Okay.
And there being none, we will move on. Our next item on the agenda is a discussion regarding odor complaints from the Sawyer Foods on Westford Road. And I believe we were going to have the DPW supervisor and someone from the Sawyer joining us for that discussion. Dan, how are you? You're muted, Dan, just to let you know. There you go. Hi, Dan.
Yeah, hey, good evening. How are you?
Great. Thanks for joining the meeting. Appreciate it.
Thank you.
Yeah, it's nice to meet you with email, but
Yeah,
was meeting you for the first time.
good to see you, even though it's Zoom. We're almost there.
Yeah.
In person.
Almost.
Almost there.
Do we have anyone from the Sawyer?
Doesn't look like it.
Dave, this is Cindy. There
Hi.
was someone else popping in and out of the waiting room.
Okay.
Name was Ebenezer.
That's him.
Oh, okay. So he'll
Yeah.
probably be back.
Do you want me to just do a quick update, Steve, on the Neshoba stuff while we have a couple of minutes?
Dan, do you mind standing by for a second on that?
No, I'll stand by. That's fine.
Sure. Why don't we give him 5 minutes and hopefully he comes back on.
Thank you.
Okay. Steve, I sent you some inspections for, actually, I sent them to the whole board, Lazy Mary's and Dunkin' Donuts.
Yep.
So those are all set. We issued the frozen dessert license for Wendy's. And just real quick, also on the agenda, is 111 Fitchburg Road.
Sure.
Yes.
It's just a really quick update. I was notified that there's a kitchen going in, but they had
Does
not
everyone
applied.
know, Bridget, 1 second,
Yep.
Trish and Pam, are you familiar with the address 111?
No,
Mm-mm.
So
No.
It's the old
111 was, in our time, it was the Rotor Club.
okay.
Oh,
There's
okay.
a, yeah, it's a temple there now, right?
Correct,
Yeah.
correct.
Mhm.
Okay.
So
Um,
without, Bridget,
yep.
just can you kind of go through what happened to get you down there?
Okay, so I was notified by Bob Bozak that they were just down there or responding to something with a fire suppression system. And it had something to do with a kitchen stove going in. And because we had not had any plans before us for a kitchen going in, I asked Charlie just to go down with me as well, and Bob from the fire department, just to kind of see what was going on. So we met with the owner of the property there. And the main issue is that they currently have a septic system there that is not designed to handle the flow from food. So Charlie ended up, so they don't have the septic system designed to handle the flow for food. And Charlie ended up issuing a cease and desist on the property just because of the amount of work that was being done. And I think there was some permitting issues on his end. So I'll be working with the owner on the septic issue and the kitchen issue. But I just wanted to give you an update, just in case you had heard anything, that there was a cease and desist issued.
Okay,
But
Thank
it's
Is
you.
this
just,
food
just
for the
for that.
members? Oh, sorry, go ahead, Trish.
No, I'm just curious, just for that, they're still able to occupy the building and have their meetings there? Nothing?
No.
Okay,
Nothing.
okay.
Oh. And I was wondering, is this food that's prepared for the employees or members of the temple, or is it for the public?
Because they've not formally given us anything, I can't fully answer that yet.
Okay,
My
right, right.
understanding from talking to him is they at some point would be cooking, and the food would be for consumption by the members or visitors, and there can be up to 300 per day is what we were told when we were there.
Okay,
So it's a pretty big operation.
okay.
I did notice that when the warm weather, when they first went in there, I go by there a lot to go to my mother's, they had a lot of grilling going on out there in the warm weather, so, and there were quite a few people on the weekends.
Bridget, was there also a question about it being used for habitation?
Yes, we discovered a couple of bedrooms in there too. So Charlie is working with them on that as part of, I think, the cease and desist.
Okay, so we're waiting now. The cease and desist has been ordered or issued already. There's really no other action that this board, I believe, needs to take at this time.
Not
Is
at
that
this
correct?
time. I just wanted to have you be in the loop in case
Absolutely.
something came up and, or if you heard anything.
Yep. Pam or Trish, do you have questions or?
No, that
now.
makes
That
sense to
answered
me.
it all, yeah.
Well, hopefully we can work with them for a suitable outcome for everybody.
Yeah.
Yep.
Okay, let's go back to the agenda because we've got people waiting.
Okay.
We did invite Nasoya. I hope they have a chance to be here. But for a public discussion, we've received numerous complaints of odor from Nasoya. I spoke to Dan about this maybe a month ago. He gave me an update, and I know preceding my being part of the Board of Health, that you both have been involved with other issues regarding the odor from Nasoya foods.
Yeah.
So I thought in terms of going forward, Dan gave me a really good update on what was going on and the cause. And I thought it was worthwhile that if anyone is watching the Board of Health, that they know that the town of Ayer is reacting to any odor complaints. And that it is not a town of Ayer issue in terms of causing the problem. But Dan, if you could update us on that and maybe just go over briefly what led us to this point, I guess would be helpful.
Yeah, so it kind of, it's been going on for a long time. When I first got here in 2015, there was odor issues in that area, and I just joined as the town engineer. Um, but the most recent issues were this past fall. That involved the process, which their wastewater treatment process, their
Mhm.
operation was not efficient. And we ended up discovering, we had several calls at DPW, and I think you guys had them too, obviously. Down, especially at the condo area, 18 Westford Road. So we ended up discovering when we did some testing that their pH was below the acceptable limits in their permit. And additionally, they did have some higher BOD waste being sent to us, and we were, getting on them to get that corrected. So eventually it came to a point where they weren't correcting things when we sent them an administrative order to shut down until they could correct their wastewater discharge. And they had to prove, they had to have 3 straight days of acceptable discharge to our wastewater system. So basically, the way it's configured out there, Nasoya discharges from their facility directly to our pump station, the Stony Brook pump station. And then it pumps from there up to Westford Road at the intersection of New England Way. So that's why the condo area was receiving most of the odor complaints were from that area, because that's where the first point of contact where the waste kind of ends up getting into the gravity system is up in that area.
Yeah.
So that was the episode this past fall. And that's kind of when I came on as director. So over the years, I've noticed it too, is they've had a lot of turnover there, a lot of change of hats. And so there was a new crew at that time that had just came in, a new crew of operators for their treatment operation. And we sat down with them, the town, the DPW, our IPP consultant, which is Hoyle and Tanner. And so we went over the deficiencies and then the administrative order and what they needed to do to correct things. And it didn't include just correcting what was happening at that time, but also doing having a consultant do a study to determine how, what else they can do to correct their process so that we aren't having upsets and issues like they've had. And then the most recent episode in December, which I was mostly copied on, was because their RTO, which is their air treatment unit, the regenerative thermal oxidizer, that went down. And apparently they take it down for routine maintenance, but they found other issues. And so it was down for a prolonged period. And I think they have a wet scrubber. I'm not too familiar with the system, but that's their backup, and that wasn't working because of cold temperatures. So once they got the RTO back working, the issue in December went away. But we do, you get them too, or I get them now, is the odor logs that are reports from out in the area. So I have noticed a couple come in recently, and I don't know. I didn't follow up on the cause or anything. But I know that's basically in a nutshell what's occurred since this past fall until now. And you're right, the town, we were out there, myself and my wastewater division, doing some monitoring, trying to track down where the odors were coming from back in September. And ultimately it led us to Nasoya's waste stream as being the source. And then once they fixed their operation, the odor complaints went away, and the odors went away. So
Dan, are they communicating with you in terms of their operating plans or any changes to be compliant? And I know that the state is involved in terms, Bridget, exactly what's the state has sought a compliance order directly?
Yeah, so they administered, I think it's a enforcement order, and they fine them. Or something I forget the technical term, but they just issued them a fine, I think last week.
Yeah.
Of almost $20,000. And again, I started getting the calls about complaint about the odor. So I started following up, as well as some of the people in my office. And I actually have been calling in the complaints as well when I smell it. I just have to follow up with DEP to find out what's going on this cycle.
Okay. Dan,
Mm.
are you in that loop with DEP or?
I haven't been in contact or any loop with DEP on any air quality issues. I do get the odor logs now, but as far as the air quality, no. You know, the wastewater for sure. Obviously, we permit. Or Nasoya has a permit through us, and we have one through EPA DEP for our plant. So that's kind of how ours works.
Is there a mitigation strategy that Nasoya has issued with the state or with anybody in terms of corrective action?
As far as odors, I don't know. But for wastewater, they do have recommendations from an engineer from our most recent report to better their treatment process. And we're kind of in the works with them on doing that.
Okay.
Hmm.
Is there any communication back to the town though from Nasoya in terms of this is what we are doing for corrective action? I was hoping that we would have someone from Nasoya joining us tonight that could
Yeah.
maybe help us understand that.
Yeah.
And certainly there's no denigration from this board towards Nasoya, but I think that the town deserves to understand what their mitigation plan is.
Yeah,
Yeah.
and I'm wondering too, Dan, if this was an issue when, you know, when it started bumping up against Ayer's wastewater treatment, was when you had that the high or low pH values?
It was low.
Low,
six,
okay,
yeah.
so it was acidic. So are you satisfied that they're doing some appropriate, at least ongoing monitoring of pH or?
Right, so that was part of the administrative order. We put measures in place to have pH monitoring regularly.
Okay.
They're going to also be adding hydrogen peroxide to knock down hydrogen sulfide, which they have been eliminating from there because they've had a good treatment process kind of since they kicked back into gear after our administrative order. So they haven't had any issues in the
Okay.
recent past, but I know it's been, and you know, like I said, this has kind of been an ongoing thing even before I was director for several years. It's been
Yeah.
hard with Nasoya. They've always had a change of hats turnover over there,
Yep.
in which we've, you know, dealt our best with. And I know, you know, we've had administrative orders and fines for them too from our end. But as far as our treatment plant goes, we haven't been sent any slugs from them in the recent past. Even when they had their administrative order, it wasn't upsetting our process. But
Okay.
in the past, we have had times where
Okay.
they've sent us such poor quality waste that we've had to shut them down because it's affecting our process at our biological plant.
I noticed the odor on
Yeah.
Westford Road, I want to say within the last 2 weeks. Driving down Westford Road with my windows up, you could still, it was a noxious
Yeah.
smell. Yeah, I don't know if that was a one-day event or an occurrence that happened. I think there was some complaints at the time, but you know, should we ask Nasoya in terms of what their plans are for mitigation? Is that, do you
Steve?
think that's appropriate? Yes, Bridget?
I'm sorry, I popped off the screen for a second. I just wanted to get to an email that they had sent out on January 27th. That
Okay,
it was an update from them. It kind of, the first piece goes to what Dan was saying about the RTO being under repair and the scrubber and some issues with things being frozen. The second issue they said is their wastewater team is working on the biological process system called biotowers to clear any blockages that may prevent proper aeration to the system. Their chemical vendor systems administration's on site working with the team to address this issue. And they said that just please try to be patient with them as they're trying to address that issue. And so that was at the end of January.
okay,
But they did, I don't want you to think they didn't respond. They did.
sure.
Yeah.
I'm gonna forward, I think I forwarded that to you, but just with Wi-Fi, I'm not always sure that people get what I forward. So-
I remember that now, Bridget.
Okay,
I remember seeing that.
Mhm.
okay. So that seems what the problem is, it's possibly still the biological process that they're working on. I can ask for an update from them if you would
Well,
like tomorrow.
I
And-
don't want to create work for anyone, whatever the board wishes, but I guess we could let them know we're monitoring it. If they submitted a plan, I guess we
Mm.
need to give them the time to make sure the plan works. But this certainly is not a town of Ayer caused problem. It is,
Right.
you know,
If you're okay with it, I mean, I don't think, that was back on January 27th. I could just send, if you are okay with it, it'll take 5 minutes for me to send a quick email asking them, where they are with.
I think that's fine.
Yeah.
I'm okay with
Okay.
that. Pam, Trish,
No, that
Yes.
sounds reasonable to me.
okay,
Okay,
let's
It's
do
always
that.
difficult with them because I don't know if it is the turnover of personnel or what really is at the root of this, but we keep circling back and back
Dan?
with them on this.
Yeah.
if you don't mind me asking a question, Dan,
Yep.
if they have an increase in production, let's just say that they have increased, their business possibly by 25%. Is there a chance that that could be impacting what's happening too, is just the accumulation of wastewater from that itself?
It's hard to say because right now they discharge to us basically the maximum allowed flow they can. So I don't know how much room they have to increase
Okay,
their production. Yeah, their flow and their BOD are pretty much maxed out, 170,000
Wow.
gallons a day. So they're right up against it now. They've been actually, before I took over as director, they were working with the previous director on of gaining more capacity in our system. And I guess that just didn't end up coming to fruition, and they haven't asked in a while about it. So
so the next question is there any chance that they could be taking stuff off-site and leaving it out back before they transport it, causing an odor?
yeah, I think there's a potential for that. And one thing I know that does occur, and you kind of mentioned it, is they have those bio towers out there. And if they
Yep.
have an upset at one of those,
Mhm.
it ends up foaming over and they end up venting it out. And so that's
Oh.
basically just venting out to the air.
Okay,
I think it's happened maybe once or twice since last fall that I've been alerted to one of those. So, I mean, that could have been one of the causes of the recent odors. But that's something we get alerted about at DPW, or our IPP gets alerted. So, I mean, I could track those.
Maybe to move forward, I think if Bridget can send a letter just asking them for an
Yeah.
update, let's review the letter, see what they have to say,
Mhm.
and hopefully there's a mitigation plan that this doesn't continue. Is the board good with that?
Yeah,
Yeah.
Okay.
Yep.
Robert, did you have any comments? I know you've been sitting patiently
Yeah.
there, but
And Mr.
Um,
Chairman, thank you. Just very briefly, for the board's benefit, and I agree with your approach and the approach of the board. I just wanted to add that on one hand, Nasoya has been a valuable business to the town of Ayer, and they're our largest user of water and wastewater, which is important. But on the same note, over the years, the key thing is the communication. And Mr. Chair, I'm glad to see that you put this meeting together, that you invited them, and something must have happened, that you're monitoring and that you're aware, because in my experience, there has been a lot of turnover. Whenever there's turnover with workers in the plant, you can almost set the odor complaint sometimes to that. When there's a lot of turnover internally, there becomes process problems, and there's been a lot of turnover on the corporate level as well. So
Yeah.
yeah.
Mr. Chair, I appreciate, it's definitely an issue very important to the town. So thank you.
thank you, Robert. If there's nothing else, then Bridget, if you can draft the letter, I'd be happy to review it with you. And hopefully they have a plan that will be satisfactory to the town.
Steve, did you want me to I can draft a letter, or would you prefer I draft an email and then I can copy DEP and
Whatever you, I think electronic is easier than doing
Pass, yeah.
paper.
yeah,
And,
I think if we copy people on it too, it just gets the attention.
yeah, I think that's a great idea.
Okay.
Super.
Yeah.
Thanks.
Thank
Sure.
you, Bridget.
Okay, moving forward. We have the mask mandate. The town of Ayer, the Board of Health highly recommended, but
Right.
I believe that in most cases, the mask mandate is being lifted. I know in most locations. It would seem to me as though the signs that we posted throughout the town, it may be time to think about taking those down. I don't think that
Mm.
necessarily, I don't know, maybe we still want, people should do what they think is in their best discretion.
Yeah, I do too. I mean, I guess, although I don't always wear, it kind of depends on where I am. And I realize that's silly because there's no correlation really between where you are. But I want people to feel safe continuing to do it if that's what makes them feel safe.
Yep.
I think that was one of the best things for me out of this whole, even though it did get me in the end, was going almost 2 years without getting sick because I was either home or I had a mask on my face. And it's a good kind of healthy behavior that I'd love to see catch on in our society. I think it might, I think we're kind of at a tipping point.
At the time we discussed the mask, it was because the numbers were rising dramatically
Yeah.
throughout the
Yeah.
entire area. And I think that phase has passed. And, I think that a lot of the businesses and restaurants in the town posted the signs voluntarily. They didn't have to,
Mhm.
but it may be a time that's, people need to do what they feel comfortable with. I agree with you entirely, Pam, but in terms of the board making a strong recommendation for that, it would just seem to me as though it would be time to
That's
take the
true.
signs,
Yeah.
time to take the signs down.
Yeah, that I would agree with that. It would no longer rise to the level of a strong recommendation.
Right.
It's more personal.
Yeah.
What you feel is the right thing to do.
Bridget,
I
how do you
almost
feel?
feel
What do you
like,
think, Bridget?
well, I'll be really quick. I almost feel like at some point it's time for the sign that says, please remember, if people are wearing masks, they might have a compromised immune system, or
Yeah,
have a loved one at home that is suffering,
Sure.
just so that people
that's
don't
what
feel
I'm getting at, right?
Yeah. it's okay, and that's exactly it, that some people, that's something that we're trying to, get across now, is that there are some people that just feel safer wearing them because
Sure.
of either their health situation or being a caretaker or their job. So we need to, be tolerant of that and not,
Absolutely. But
as adults, if we are kind to each other, our kids will be kind to each other. And because there will be some kids still wearing them in school.
Mhm.
sure.
They
Yeah,
are. Yeah.
But
Yep.
if the board is okay, I think we should, as we see the signs, ask the owners that, that's no longer the recommendation of the board or highly recommended. We didn't get to the point of ever ordering it as some towns had
Right.
done. And
Right.
I believe that was a good decision. But
Mhm.
I think it's
I think
time
it
that
was the
those,
right thing, yeah.
I think that if the signs come down as we see them, I think that would be good. If I see some, I'll mention to the owner or whatever that, you can take that down, or I'll take it down for them if they're okay with that. As we go about our business, is that
Yep.
satisfactory?
Bridget, is that okay? That's kind of does that put, well, no, because it's not anything that we wanted.
No, I mean,
mandatory
some
compliance
people
with,
have taken
so.
them down already, and that's,
Yeah.
we just,
Yeah.
and people are now asking what, do they need to keep signs up, not just in Ayer, but other
Mm.
towns?
Yeah,
The answer
yeah.
to that is no. And then the next question is, people are also asking, can we keep the signs up? And the answer to that is yes, that's your business.
Yeah.
And if that's what you want, you can certainly do that. So, but you know, people have been asking, and as I'm doing inspections, then, you know, I can talk to them as well.
Yeah, so we're just clarifying that we're not making the recommendation on paper
Correct.
anything anymore, right?
Correct.
Bridget, do you get the sense that there are some businesses that are kind of relying on our recommendation so that they're not the bad guy?
Not now. You know, I mean, there were some definitely previously, but right now,
Okay,
no. I
okay.
think
Because
I think they're pretty.
I would
well
actually
aware.
not want to take that tool completely away from them if we have business owners that think that it is helping. And in that case, I would suggest maybe more of the official Board of Health position is to do what's right for your situation.
Correct. And
And
we're going to
not
be
give
sending.
people a hard time either way. I
Right.
guess.
And I think that's the thing too. And, you know, I know there's no residents watching now, but there are some positions that I still see the staff wearing masks, and that's really surprisingly some restaurants. You know, in Mass, New Hampshire, they're still deciding for themselves, because they are around so many people, that is what they feel comfortable with. And again, you know, we just have to really get back to being kind and
Yeah.
Yeah,
understand that.
Yeah,
My
Some people-
motivation is coming from the relevance. If we have to do this again, and there has to be recommendations to wear masks, I think if we just leave them up indefinitely, then it becomes an irrelevant
Right.
Yes.
exactly.
Yeah.
information.
Yeah.
Yeah,
And
you
at
start-
this point, I think it's, you know, it should just be masks are optional.
Yep.
Whatever you want to do, whether you want to do it or not, it doesn't have to have the backing of
Board of
us
Health.
right
Yep.
now, Board of Health.
Yeah, that's fair. Let's
Okay.
change to the
Can I
just don't
just-
be a jerk strategy.
Yeah.
Or
Can I just say
recommendation.
something
Yeah.
to this,
Sure.
please?
Heather,
Yeah, no, the reason I wanted to put this on the agenda is I had a woman who owns a business in town. I don't think she operates a store. I think she has a legit office. And because the board's recommendation was that they highly suggest that people wear masks indoors, she wanted to know if there was gonna be another position that they were gonna take that away, since the CDC had backed off their recommendations. So you have to understand, we don't just have storefronts and restaurants in town, we have many
Right,
office
right.
buildings
Sure.
too, that were
That's
also
right.
buying by that suggestion of wearing them indoors, which is why I wanted this on the, is why I asked to have this on the agenda.
no, I think that's great.
Thank
And
you.
I think
Heather.
that,
Yeah.
you know, our position, and if you get phone calls, would be that if people want to wear a mask, that's great. It's an individual decision.
Mhm.
Yep.
But in terms of our concerns from a Board of Health perspective,
Yep.
the signs, I think, should come down.
Okay,
We good with that?
Works for me.
Yeah.
Yep.
absolutely.
The minutes from the 24th of January.
Which I need to open and look at again. I'm trying to go paperless for
I looked
meetings.
at them earlier and I didn't, nothing was glaring, Steve. If you were still doing that, where you are going to sign
Yeah,
until we meet in
I think
person.
as long as we
Yeah,
make a
here we
motion
go.
to approve the minutes at the open session, then I'd be happy to do the signature. So
Okay.
if there's no additions, deletions, or corrections, is there a motion to accept the minutes as presented?
I make a
Yes.
motion to
Oh, I'm
accept.
sorry. Geez,
No,
I'm just dying to
sorry.
make a motion tonight. So I move that we accept and approve the minutes of our January 24th, 2022 meeting.
Is there a second?
I second that.
Motion's made and second to approve the minutes of the 24th without any discussion. All those in favor?
Aye.
Aye. Okay, I'll stop by and sign the minutes.
Thank you.
And we talked about COVID-19 and the reports that I've seen, the numbers have gone down dramatically, but
Mm.
Bridget, is there anything you want to add to COVID-19 or?
I just want it to go away. That's it.
As we all do,
Yeah, agreed.
as we all do. Heather, are there any bills or mail or action items
The
outstanding?
only item, and it came in after I sent the packet out, the nomination for the animal control the barn inspector came in.
Mhm.
So I'll put that on the agenda for the next meeting to have that voted on.
Okay,
We have some time for that. That didn't get signed until April of last year, so we have time on that, but that just came in the office this past week.
okay, great. Does anyone else have anything else they want to add?
Oh, while Heather is chiming in, we wanted clarification on the date, of that next meeting.
The meeting
From what-
after,
From
Mm.
what I can tell, because the Patriots Day is the 17th, 18th.
Yeah,
Yep.
So I believe, and I had to double check on the town calendar, that our meeting would be the 11th, but I need to double check the town calendar. And if you bear with me for 3 seconds, I can look, I can look it up to
Yeah,
see
I
when
can-
town meeting is.
yeah.
our next
'Cause I
meeting is the
don't-
28th though, right? We're meeting on the 28th, correct?
Yeah,
Of
But it-
Yeah, we
Um,
meet again on the 28th, yes.
we're just trying to
And-
figure out what happens in April because we know the schedule always gets.
Right,
And my
Yeah, the
understanding
media-
is we're back in public session after April the 1st. Is that right, Robert?
Yeah, okay.
Yes, Mr.
Yes.
Chair. So yeah, the town's plan is as of April 1st, each board or committee can go back to in-person. And just so you know, Mr. Chair, if the Board of Health decides to stay remote, the state has extended the deadline till July 15th, the open meeting law, till July 15th, we can keep doing remote. But the plan is for everybody to begin to go back to in-person as of April 1st.
Great. Thank
Okay.
you so much.
Yep, and so town meeting is the 25th, so the only meeting we would be able to have in April would be the 11th.
okay.
Okay,
That sounds good. And we'll be waiting to hear from Robert through council in terms of an update. And if we have to have a special session, we can schedule that hopefully when everyone's available. Great.
sounds
Well,
good.
Again, happy Pi Day, everybody. Almost happy St.
Yeah.
Patrick's Day.
Absolutely.
Is there a motion to adjourn?
I make a motion to
Ah.
adjourn.
Is there a second?
I second.
Motion's made and seconded. The Board of Health will adjourn the meeting at 6:35.